This program is for informational, educational, and entertainment purposes only. The information provided in this podcast reflects the opinions and experiences of the hosts and is not medical or mental health advice. Always consult a qualified healthcare professional regarding any questions about your health or well-being. If you are experiencing a medical or mental health emergency, contact your local emergency services.
And of course, so often, acute pain's relative to a stress, to an injury, to something that wasn't expressed. And so if I believe that I'm always going to have the pain, and that's the program that I'm sending to my brain, your brain is not going to make you a liar. My journey is not to make you feel as if you're inadequate, right? My journey is for you to understand that you inherited inadequacy.
Welcome back to the Adjusting Your Life podcast. This is episode 111. I'm Kennedi and I'm here with Dr. Steve. We're going to talk about acute versus chronic pain.
This episode of the Adjusting Your Life podcast is brought to you by Ward Chiropractic. Dr. Steve finds what most doctors miss. And his wall adjustment technique, it can bring fast relief. Check out chiroman.com for hours, location, and to contact the clinic. That's chiroman, chiroman.com.
It happens a lot in my clinic. People come in and they say, I didn't do anything. But when I woke up this morning, I couldn't even walk. Mm-hmm. And so acute pain just really comes out of nowhere. Mm-hmm. So they bend over and pick up a tissue on the ground, and all of a sudden their lower back is in so much severity. Mm-hmm. Acute pain is usually short-lived. And I work on acute pain very similar to chronic pain, mm-hmm. because acute pain usually is pretty easy to resolve in most cases, especially when you do a couple visits on a person in acute pain. Acute pain, they're commonly in a lot of spasm, inflammation. And so when I'm working with a person in acute pain, I'm suggesting ice. Mm-hmm. And sometimes it may be so severe, say it's a neck problem, it's very severe. I might suggest a cervical neck collar, mm-hmm. to take the head weight off the body so the body can begin to heal. Mm-hmm. The chronic pain is pain that maybe has been there for years. Mm-hmm. They say, if you've had it for like 3 months, that's pretty much chronic pain. If you've had it for 30 years, it's chronic pain. Mm-hmm. So, but I find helping people with both acute and chronic pain usually is much easier than people think it will be. Mm-hmm. Someone will come in so often and they'll say, oh, I've been to chiropractors and I'm not able to move. Mm-hmm. They usually can't adjust me. Mm-hmm. And then they'll say, so don't be disappointed if you can't adjust me. And I say, oh, okay, well, you may move great. Mm-hmm. My technique is different. Mm-hmm. I do utilize wall adjusting. Mm-hmm. And I oftentimes sit a person down to do the wall adjustment. I put them into more of an emotional state and more of an exhausted state. Okay. As opposed to I could do the wall adjustment standing, but if they're in an over defense, if their body's in a massive inflammation, so often I will sit that person down. Again, looking at patterns. Mm-hmm. When someone's in a backward curve and left curve, they may be more challenging if it's a female to adjust. And so I may sit them down and put them into that pattern where they're forward in curve and maybe left. Okay. And so I just love helping people, reduce their pain. And of course, so often acute pain's relative to a stress, to an injury, mm-hmm. to something that wasn't expressed, or maybe personalizing someone's projection. Mm-hmm. Usually when I communicate with the patient in acute pain, and I ask them the question, well, when did your pain start?
Mm-hmm.
Oh, it just started. And I'll say, well, what was the stressful event that occurred right prior to this pain coming up?
Mm-hmm.
And then they're like, well, this happened.
Mm-hmm.
Well, that issue is the biggest contributor as to why people go into acute pain.
Mm-hmm.
Because most people on this planet, they want to personalize wounded people.
Mm-hmm.
And so instead of going in with awareness, they're going in with this fantasy that the wounded person will be kind and loving and all that.
Mm-hmm. And
the truth is, wounded people rarely come from kindness and love.
Mm-hmm.
They come from whatever wound that they have experienced. So, but I think it's interesting to always look if a pain pattern wasn't there,
mm-hmm.
and now it is there.
Mm-hmm.
Was there a stressful event? And if you can identify a stressful event, then unlocking that acute pain should be much easier.
Mm-hmm. So can acute pain turn into chronic pain?
Sure, because acute pain, say it's lower back pain,
mm-hmm.
it's an indication from a spinal point of view
mm-hmm.
of the person internalizing hurtful experiences. And so if a person continues to have a behavior of internalization, then when they do get hurt, it's likely that ultimately the acute pain will be chronic because they're not reframing the behavior that underlies the pain pattern.
Mm-hmm. So say, for example, someone is triggered and then they go to pick up their child and, they have like a muscle spasm and say, okay, I have to get to the chiropractor. So they come in the next day and then they're just thinking it's because they, just bent over to pick up their child. Is there a way you can tell, obviously asking that question, if there's something that had happened, can it be something that like builds on itself, like where maybe they're having a challenge at work being negated by their boss, and it could be going on for months and months, and then just this one movement?
Yeah.
Is it maybe it's that does the dysfunction at work like lower their immune system because they don't feel good about who they are?
Yeah, and again, so often our acute pain's going to come when what we're doing, say in a work environment, no matter how much we give or how great of a job we are doing, we go to a wounded person that's above us, and that wounded person was negated in their life. And so no matter what this employee does, it's not good enough to make them feel enough,
mm-hmm.
right? So we must always look at, like in a work environment, it's important to see people for who they are and where they are,
mm-hmm.
and to understand if they're healthy, if they're unhealthy.
Mm-hmm.
Are they able to validate? Are they able to encourage? Are they able to give approval? Are they able to share with people the value that they bring?
Mm-hmm.
Like, I don't care if it's my cleaning lady.
Mm-hmm.
I'm going to validate my cleaning lady.
Sure.
If it's my office manager, I'm going to validate my office manager.
Mm-hmm.
She's made some mistakes along the way, and I look at those dynamics and I stay so calm and kind.
Mm-hmm.
And it's always my job to lift someone up.
Mm-hmm.
It's not my job to knock them down.
Mm-hmm. So in the work environment where you have that relationship, are there things that someone can do in response to a boss that is negating them? Is there some dialogue they can have? Or
yes, I think it's important when we're being negated to realize, well, number one, that's not personal.
mm-hmm.
A person who's negating you was negated before you. If your fantasy is someone who was always told that what they did was not enough, it's going to validate you and build you up and make you feel that what you do is enough. It's a fantasy. They don't even have that in their reality. Recently, I had a case come in, and she had such severe right shoulder blade pain, and it was actually all right-sided. And so, of course, I'm going to, well, a lot of times this influence deals with your need for outside female approval from a dominant female. And I said, but it also can be when you look for approval from a man that had a dominant mother who repeatedly negated that man. And now there's an unconscious need to negate women. Okay. So it's such an interesting thing. This is where studying behavior and its relationship to pain is so important, whether it's acute or chronic. Because if it's chronic, it's just about programs that have gone on for a long time. But yes, for the person who works in an unhealthy work environment, one, you don't have to stay there.
Right.
The job, we can attract a different job. I believe that so often we attract a lot of the wound that we're experiencing. So if we were negated, then somehow we attract a job that's going to negate us. And so it's about growing. Everything is about awareness. It's about understanding what you're navigating in, whether someone is coming from a healthier place or an unhealthy place, and realize that there are people in life that no matter how great you are, they're going to tell you how you're not good enough. And again, be mindful that that's what we need to armor against. That's what we need to hit with active denial. You need to know who you are separate from someone else's validation, that your value isn't tied to someone validating you. Because validation, although it can be really healthy and great, it can be used against you as well. So, someone who never validated might validate you, but why would they do that? Because they want you to take on more load. And so it's so important that you don't get so injured by someone withholding validation, and you don't get so excited about someone giving you validation. Because the person to give you validation is yourself. And if your intention is to give your best, as this patient that came in with the severe right shoulder pain, she doesn't know how not to give her best. Her whole program, her whole life was to give her best. So here you're saying to her that no matter what you do, it's not good enough, and I will never validate you.
So in a team setting, for example, when you have a manager and then, there's 3 or 4 people on a team, I've heard time and time again from different people where, they've taken the lead and done most of the work, and then the manager validates the person that did the least amount of work.
Right. It can happen that way. But that's why we don't get caught up in it. And then you also get people that don't do the work, but they're in a higher place of power, and they put the load on the other person. The other person does the work, and then the person credit above them takes the credit. And so it's just about really being very conscious that the world is wounded and that we can repair our wounds with some work. But to go into any environment with some fantasy that you're going to be supported, encouraged, and validated, and told how amazing you are, and recognized for how hard you're working and what you're giving, it's a little bit of a misdirection. Because I say to people who are perfectionists, be careful when you start the new job about giving 100%, because what will happen is they're going to want 110, 120, 130%. So when you go to work How can I do the job I'm doing and save energy? How can I be efficient in what I do? And the best way I find in life to save energy is don't be addicted to outside approval. Give that up.
Right.
I don't care if it's a coworker, a boss,
Mom,
a
dad.
spouse, a parent, a teacher, a coach. Okay? It's so important to take the higher ground, to have awareness above. What's really playing out here? Is this person healthy? When have I seen this person be healthy? Is this person happy? When have I seen them be happy? Is this person good at validating when they do their best? If they're not doing it when they do their best, they're not going to do it for you when you do your best.
Right. We'll be right back. Welcome back. We're going to dive into unresolved emotions and if they contribute to lingering pain. So, Dr. Steve, what would you say to our audience that they've had some things happen in their life and they're having emotions, and maybe they're not confronting them head on or not dealing with them? How can that affect their how they feel physically?
Well, I believe so much of our pain patterns are rooted in our emotional intelligence and how we have learned to deal with emotions differently. Are we personalizing things? Are we learning not to personalize? Do we see wound that's being projected as a wound that occurred before the person it's transferred to? So to me, when we're looking at unresolved pain patterns, if it's, say, lower back pain, you must look at, are you internalizing your hurt and not expressing it? Sometimes it's hard to express hurt to someone. And sometimes when we express hurt to someone, they may react in anger back towards you for expressing that hurt you're feeling towards them. So I have always found that learning to preface my hurt is the best way to go. Meaning, I might say, all my life, I took my hurt that I was feeling and experiencing internally. And as I journeyed through my life, I noticed how when I would internalize hurt, I would have stomach problems, or I'd have lower back pain, or I'd have pain in my shoulder. And so now in my life, when something happens that's hurtful, it's important you understand it's not all about you. It's I'm now expressing truth with how I feel. And I think in doing that, there's a way to express and not get a lot of reaction back. But if you say, well, you did this to me, then you might get a defensive reaction back. But if you do learn to preface, it's helpful. But in truth, I look at that differently today. I look at pretty much everything as multi-generational. So it's anything really personal that occurs.
No.
Are people wounded before they transfer it? You better believe it. Okay. So that really gives me awareness as to when to bite on something and when not to. And then when I see it's a generational wound that's being passed, it doesn't have an impact on me like it once would have. Okay. So, because I think it's so important that we understand that most of us carry with us wound, and most of us carry with us multiple generations of wound. And those wounds then impact a person to transfer those generational wounds onto people. And so, and obviously when we see how most people deal with that, a lot of people react to it, or a lot of people deny it. But if you really see that someone's just transferring something that happened to them, and what is being transferred to you really isn't about you, then it really could impact you to not be in acute pain and chronic pain. It's just, hey, this person's wounded, and in their wound they said this or did this, and on some level I want to personalize that, and the minute I personalize it, and if I then internalize it, then I'm going to have pain directly related to what I internalized and denied.
Mm-hmm.
But if you see it non-personally, then it's like, oh, like someone being critical of you. Well, you have a right to be critical of me. Would you know how to be critical of me if no one was critical of you? That's the question.
So this is something you could say to someone.
Sure.
Yeah.
Right? And when someone's critical of me, I like having fun with it. So it's like, oh, thank you for being critical of me, or thank you for your opinion. That's a criticism. I appreciate it. They're like, what's going on? And then I say, it gives me an opportunity to work on loving myself when criticism is being projected onto me. So you're giving me quite the gift, and I appreciate you for giving me this exercise. Because in life, we want to evolve in our emotional intelligence. We want to respond, not react. We want to allow emotions to subside before we decide. We can see how people work their whole life to build their life. And in one moment in time in their life, they lose regulation. They react in rage. They do something harmful. And then, then their whole life of hard work is impacted by that moment of choosing to react rather than respond, choosing to see it personally rather than see it non-personally. So, I've changed a lot. And now it's like, there are times that I go through a process in my mind. Well, I could say something to them. My question is, are they open to hearing it? If I say something, will it make any change? If they're not open to hearing it, and I think it's not going to make much of a change, then I'm most likely just going to let it go. Just going to, I'm just not personalizing it. It's someone who has this hurt that they're transferring. And I really have it clear in my mind in my life today that things are coming from a multi-generational perspective. And as we see it that way, and that goes for, the employers that we work for, or the parents that we have fantasy that they corrected the wounds and now they're healthy enough to give us insight that we really need to empower our life, to transform our life. Because when we learn to let emotions subside, to respond in low tone, to not bite on every projection, our life transforms, and it transforms very quickly. And because people say who are critical, they're only interested in you personalizing it.
Right. Exactly.
They have zero openness to you not personalizing it.
Right.
And you go to the most critical person, you thank them for it, and you circle back, you thank you. It gives me an opportunity to practice loving myself when someone's critical. It really diffuses the situation. It's just like if someone's critical, I might laugh, right? Because one, I know it's not personal. And laughing means that I can take a projection and not give weight to it, right? So it's just so many things we can learn to do. But identifying where someone's at is a part of awareness. And if you look at a wounded person and you want to make them healthy, then the only option there is for you to be unhealthy, right? If you look at the wounded person and you see that they're unhealthy, then you say, oh, well, whatever they transfer really isn't about me. It's before me. And I think that's so powerful in life. It's not because of me, it's before me. I think that's such a vital tool to incorporate into your programming. So I think that's where the power really is. It's about, I'm an emotional male. In my early life, I would get triggered and be reactive in emotion. And I'm not that guy anymore. And so I start the year with the goal of not losing regulation in the entire year. Can I go the whole year and not lose regulation? That means if I get cut off on the freeway, I'm not, honking my horn and doing something, right? I'm not antagonizing the situation. And so that's been a great growth in me. And, really significant things have happened in my life. Some really not such good things. But, I'm coming out of all those things with awareness that even when bad things happen, it's an opportunity to grow. It's not an opportunity to sink.
So let's talk about the adjustment. And for example, if someone comes to get adjusted, is there a release, you would say, from like emotions that they have?
Yes. Sometimes, when you're dealing with someone's chronic pain pattern, and say it's a right shoulder problem, and it's never really been released, and then you give this pretty intense adjustment, and then all of a sudden, someone who has never cries breaks down and cries, right? Or maybe you go into the body with deep muscle work, and you go into where they're storing a wound, and you go into with pressure, and then all of a sudden they start crying, they start emoting, and they start releasing. And so, it's very interesting because I'll have ladies in high denial that, when I say to them, okay, are you good at telling yourself you love yourself? Oh, yes. Oh, when was the last time? Oh, I don't know. Okay, which means they're not good at it.
Sure.
And so I say, okay, follow me. Say this: I choose to love myself today. And they, sometimes get that out decently well. But a lot of those ladies, when I go to the second love command, lose it. And I'll say, okay, say that you love the wonderful woman you were created to be.
Right.
And so you see ladies who are in high levels of denial, they're in masculine, and they have always wanted to be loved in their feminine, but they didn't feel adequate in their feminine. They made a decision, unconscious decision, that maybe their father didn't love them because they weren't a male. And so it's just interesting to me that a simple command so often can cause a result of an emotional reaction.
Sure.
Just conveying that they love the wonderful woman that they were created to be. Or I might say to them, because so many of those ladies are overdoers, overpushers, their mental minds dictating their physical body. And so when you give them clarity that, well, your value is not in what you're doing. Your value is in who you are. And who you are is amazing. And you have always been amazing. And so sometimes when I convey that program to ladies, they will break down and cry because they haven't heard that, and they haven't heard it from a male. So all of a sudden they have this root need of male approval, love, validation, and then they're hearing that for the first time from a male, and then all of a sudden, they're in emotion and they're releasing. So it's really important when we allow our emotions to release. And it's also important to understand that a lot of the traumas that are within us, the person who projected that trauma had trauma and maybe even worse trauma, and that they're coming from. And so also understanding that it's not personal, that there's a story, there's a narrative. It's why relationships struggle so much. I mean, they just struggle so much.
Yes.
Even relationships that are together struggle, right?
Yes.
Because so often when you're studying male-female, you're seeing opposite patterns of behavior. You see a woman that's right, you might see the male that's left, or you see the male that is in right curvature and he's attracting the female that's in left curvature, right? And then when you look at same sex, you might see two men that are right curvature, and they may struggle because they both want to be right, or they may struggle because they have this root need of female parent approval. And they may not need male approval at all, right? Or two ladies who might be left curve. One might be further left, more dominant. One may be still left, less dominant, but still operating in this masculine,
Right.
and still struggling with how do I express the hurt that I feel. Because so many times the left curve ladies are processing hurt, right? And then when they lose regulation, they become verbal. They become authoritative. Their loss of regulation means they don't lock down their tongue. If you don't, if what's coming out of your mouth is a lot of unhealthy dysfunction, lock down your tongue, get a handle on it, come at it differently. If you're a woman that is verbal and you get upset and you have this wound, this generational wound, this father trauma, whatever it is, be careful about projecting that onto your partner, because it's not your partner's fault that you're wounded and hurt, and it's not your partner's responsibility to resolve that hurtful experience. And if it's not resolved by you, then what you're doing is transferring it to someone else. And then you're setting it up to fail because that person can't resolve it. If I say I got to fix you, then I'm saying you can't fix you.
Right.
And if you're dominant, you do not like that. Right?
Right. We will be right back.
This episode of the Adjusting Your Life podcast is brought to you by Ward Chiropractic. For over 30 years, Dr. Steve Ward has been helping people get to the root cause of their pain. He's a second-generation chiropractor who looks at the whole spine, not just the sore spot. With standing and seated full spine x-rays, Dr. Steve finds what most doctors miss. And his wall adjustment technique, it can bring fast relief. Back pain, sports injuries. Check out chiroman.com for hours, location, and to contact the clinic, or stop by Ward Chiropractic Family Center today. Mention this ad, and you'll get a free recheck 2 hours after your first adjustment. That's chiroman, chiroman.com for more info.
Welcome back. We're going to talk about how to reframe pain patterns. So, Dr. Steve, when a patient comes in and you've given them awareness and an adjustment, what do you send them home with that they could apply the things that they've just learned during their visit?
Well, a lot of times when I've treated them, I've balanced them, I've given them some awareness, the level I think they're prepared for. So often I'm going to come back onto the patient with, well, what are you getting from this? What have you received from me? What did you hear me say? What commands are important for you to express? How does understanding the wound around you now impact you? Is it still going to impact you, or are you going to see it non-personally? So I'm always giving people different level of awareness, and so often I'm even walking them out of the clinic, and then I'm giving them more coaching on their way out. Or the people that are more heavy denial, I will put them in the waiting room and I'll put an ice pack on them. And I will really have other people impact them. In my clinic, when patients come in and they're new, the patients in the waiting room do an amazing job selling me. And they say amazing things. And I have this one gal that comes in, and she is so great at expressing what I have taught her and how she just gives it so freely to the people around her. And so it really shows that I gave her awareness. Now she's really getting it. And now she's sharing it.
Right.
And so even for the people in the highest level of denial, they can benefit by hearing someone else's story.
Sure.
Because so often when dealing with heavy denial, it's important that we give them awareness, but you may not be able to come at them too much with what the dysfunction is that's resulting in their pain. However, someone else can do it, and someone else can share their story. And it's really wonderful. My waiting room, such a wonderful place. And when I have a walk-in business, and sometimes I'll have 20 people in the waiting room, and they're just teaching and coaching and sharing. And, I'm hearing every day, I have patients, I love you, Dr. Steve. I love you, Dr. Steve. I love you, Dr. Steve. How many times do I hear that in a busy day? A lot.
Yeah.
And even people that, they just meet me and I've given them something profound. And now they see their life differently. And they realize, oh, wow, thanks for validating me. No one ever's done that. Or thanks for giving me clarity. It makes a lot of sense to me, and I can apply that, and I can do this differently, right? And I'm watching them. I'm listening to what they're saying, because sometimes people will say, well, you gave me a lot to think about, and this will help me to improve on myself. And I'll say, well, that wasn't my journey here. My journey is not to make you feel as if you're inadequate.
Right. Like you have to do.
Right. My journey is for you to understand that you inherited inadequacy. And so your program is walking away with, I need to fix these things in me. I don't feel that's the case. I feel like the awareness is, I need to release who I'm not.
Right.
Instead of, oh, this is my burden to fix. Well, if it's a program that's inherited and you bonded with it, it's not your program to fix. It's your program to let go of. Right? It's your program to rewrite that program, reframe that program, have a different way of looking at it. How am I going to deal with that dominant female in my life? Am I going to keep taking it personal, or am I going to be armored? Am I going to put on my spiritual armor? I like to always put on my spiritual armor, and I'm very conscious of when someone's coming from fear, and when they're coming from fear, my armor is blocking their fear. And what's the primary purpose in life to master? Your willingness to love yourself in the middle of your storm, with the most critical or most dominant person or the most unhealthy person. Because someone can't make you feel a certain way. You empower the wounded person, and you lose your identity to their view and their trauma. And so as we grow and we learn, this is very simple. It's not hard. It's very simple to armor, to acknowledge if someone's coming from love or fear, if they're critical or kind, if they're uplifting or if they're wanting to pull you under. Are they a life preserver? Are they an anchor? Right? Well, I see an anchor in 3 seconds. And you're not pulling me under, because I'm not needing to be enough for you. And so but then there's the other level of, what is your pain?
Mm-hmm.
Is it headaches?
Mm-hmm.
Well, what do you need to work on? Not being so critical,
Mm-hmm.
not being so mentally punishing,
Mm-hmm.
not taking on a generational shame or a generational criticism
Mm-hmm.
wound,
Mm-hmm.
right? Realizing that you want to be kind to yourself even when you're under stress, even when the expectations are unreasonable.
Mm-hmm.
You want to know who you are, separate from what you do, right?
Mm-hmm.
If it's lower back pain,
Mm-hmm.
okay, are you personalizing this wounded person? Are you then taking that internal?
Mm-hmm.
And then the fact that you internalize it, now you're in significant pain.
Mm-hmm.
Or are you realizing that it's really not about you, that your journey is to not personalize it,
Mm-hmm.
to allow a person to have an opinion, which is their wound they're transferring, to not get caught up in it, not lose your
Mm-hmm.
identity to it? You know, well, it's okay, you feel that way about me. I don't feel the same.
Mm-hmm.
Or
I
it's
like that.
okay that you're critical of me. That gives me an opportunity to be kind
Mm-hmm.
and loving to me.
Mm-hmm.
Everything that's transferred to us is an opportunity for us to grow.
Mm-hmm.
And that's where awareness comes into play.
Mm-hmm.
The more aware, the higher your emotional quotient.
Mm-hmm.
The better you learn to respond and not react,
Mm-hmm.
the higher your emotional quotient.
Mm-hmm.
The better you are at being kind and
Mm-hmm.
generous and loving to others, and having really good interpersonal skills between you and another person, the higher your emotional quotient.
Mm-hmm.
Your level of empathy. I have empathy for people,
Mm-hmm.
and but I don't hit dysfunction with empathy.
Mm-hmm. Right.
I'm a high empath,
Mm-hmm.
but I've learned that empathy in my life, why I was high empathy, is because I got misdirected
Mm-hmm.
in my life. And when my dad, left my mom, and my brother died of cancer,
Mm-hmm.
and my sister and mom didn't get along and she moved out, and then I saw my mom in a wounded place,
Mm-hmm.
in an emotional place, in a hurt place, which I hadn't seen, it impacted me to be a higher empath. So my high empathy, when I had it tested, they said I was a 99% empath.
Mm-hmm.
And they said, well, that's good, but it's also harmful, right? So it's good to have empathy
Mm-hmm.
and compassion for others.
Mm-hmm.
And I have compassion for the most wounded, but I also have compassion for me. And just because they're wounded doesn't mean that that's about me,
Mm-hmm.
right?
Right.
So I don't just naturally jump in and say, what can I do to fix you? Or how can I save you?
Mm-hmm.
Right? So that's changed in me.
Mm-hmm.
And how motivated are you to take information and awareness
Mm-hmm.
and apply it to your life?
Mm-hmm.
Because all those combine to make your emotional quotient.
Mm-hmm.
And I can just tell you, my patients come in with a certain EQ.
Mm-hmm.
And after the first visit, their EQ goes way up in one visit.
Mm-hmm.
And that happens because of the amount of awareness the body is actually telling us.
Mm-hmm.
Our body's talking. Are you listening?
Mm-hmm. So what would you say for patients that come in and they gain this awareness and they realize that the programming, that they have had is, from their parents and potentially like their parents, but say both parents have passed away. How do they process, through that without, some people might say, well, I can never address it with my mom or dad. And that might seem to be something that limits them being able to reframe the things that they have learned. What are things or tools that those patients can?
Well, I would love to heal my traumas with every person, but sometimes people pass away before you heal the trauma.
Right.
But it's still through awareness that says, okay, just like I was passed on certain genes and and certain genetics from my parents. I was passed on certain behaviors from my parents. And now with my awareness, I can understand that my parent is still with me. They're in every cell of my being. They made me. So even if a parent's not present, they passed away, they're still within you. And you can still heal that dynamic within you, and you heal it through awareness. You heal it through forgiveness. And you know, like, I believe in forgiveness, even when really bad things happen, because I find when something bad happens, if I go into judgment or some heavy anger, it doesn't even harm the person that hurt me. It harms me. So, and in scripture, there's a verse that says we forgive 70 times 7. I believe that to be such a powerful verse, because we're influenced by many generations of family wound, and the people that have hurt us were wounded before us. So is it personal or is it generational? It's generational. And that's why forgiveness should be more easy to do or get to, right? It's like, oh, they were just wounded and this happened and they passed this on, and I have this issue that I'm holding on to, and now they're dead and I can't release it. Well, watch the program. Why do you think you can't release it? Releasing it is just about having awareness and seeing it differently, and seeing, oh, they're wounded, and in that wound they transferred this narrative, and now I see it differently, so I can forgive them. I can let go of the intensity I may feel towards them, and I can heal in me. And healing always is about finding the love for you. You know, the fantasy is, I want the love to come from the parent to the child. But the truth is, the love so often is going to come from the child to the parent, as we can see in your story. You know, there was so little going on with your father. And then you got the memo and you decided to do it differently. And then what did you find? As long as you came from love for him, he's open. He's a kind man. He's a generous man. He's an emotional man. But men, if they think they're just going to be criticized, are going to run from it, right? So it's always about letting go of your perceived trauma. And because what you think it is not what it is. It's a story before you. And it's always a story before you.
Thank you for joining us on today's episode of the Adjusting Your Life podcast. For more information, please see the show notes at adjustingyourlifepodcast.com, and we will see you next time.
This is a broadcast of the Adjusting Your Life podcast, produced by Adjusted Life Media. All information contained in this episode and all other content provided on this channel is for informational and entertainment purposes only. This content is not a substitute for professional medical advice, diagnosis, or treatment. If you or someone you know is experiencing a medical emergency, please contact your local emergency services. Dr. Stephen M. Ward, D.C., is a board-certified doctor of chiropractic medicine, licensed in the state of California, County of Los Angeles. The Adjusting Your Life podcast is written and produced by executive producer Jamie Knapp, and co-produced by Kennedi Hall and Dr. Stephen Ward as Dr. Steve. For more information or to connect with us, visit adjustingyourlifepodcast.com.